Hello and welcome to the third module of the basic neuropharmacology of natural products. In this module, we'll talk about acetylcholine, how it works, and medicinal agents that affect its function. Acetylcholine is the principal neurotransmitter in the parasympathetic nervous system, and that's the branch of the autonomic nervous system that controls things like digestion and blood vessel function, urinary function, smooth muscle that we really don't control voluntarily. It's also involved in the central nervous system, and it plays many roles in memory, learning, and cognitive performance. The therapeutic relevance of acetylcholine is extensive. A few examples are shown here. Spatial, episodic, and working memory depend on acetylcholine. Neurodegenerative disease, specifically Alzheimer's disease, involves the degeneration of acetylcholine-producing neurons. So cholinergic drugs are often used in Alzheimer's disease to improve cognitive performance and try to make up for that deficit. Gastrointestinal motility depends on acetylcholine. You can increase GI motility by stimulating the release of acetylcholine. Perhaps the most physiologically salient role of acetylcholine, although not all that medically relevant, is its function at neuromuscular junctions. Acetylcholine is what allows our neurons to communicate with our skeletal muscle. We have a neuronal impulse that triggers the release of acetylcholine, and that travels across the synapse. And on the surface of muscle cells, we have these receptors, which are ion channels that allow sodium to enter the muscle cell, and that triggers muscle contraction. Similarly, in the autonomic nervous system, acetylcholine is released in response to an action potential, and it crosses the synapse, and it binds to postsynaptic receptors called muscarinic acetylcholine receptors. To summarize the two types of cholinergic receptors, we have muscarinic receptors, which are G-protein coupled receptors, and then we have nicotinic receptors, which are ion channels. The muscarinic receptors are mainly located in the parasympathetic nervous system, including the enteric nervous system that lines the GI tract. The therapeutic relevance of muscarinic receptors is very broad, but mainly has to do with GI motility, which increases in response to agonists of muscarinic receptors. Motion sickness and vertigo are made worse by the activation of these receptors, so drugs have been developed to block the muscarinic receptors that are located in the brainstem and other areas of the body to reduce the symptoms of motion sickness and vertigo. And functional disorders of the urinary tract, like overactive bladder, can be managed with certain drugs that act on muscarinic receptors. COPD is also an area where these types of drugs have been explored. The therapeutic relevance of nicotinic receptors mainly involves memory and smoking cessation because nicotine acts on these receptors. Anticholinergics, such as those that inhibit these muscarinic receptors, cause a very familiar constellation of side effects that is shown here: dry mouth, constipation, drowsiness, and cognitive impairment. So whenever you're listening to an advertisement for a drug and you hear these common side effects, it's probably acting on these muscarinic receptors in a way that's inhibiting them. So examples would be antipsychotics, particularly those of the first generation. It's less of a problem now with the newer drugs. Antidepressants, antiemetics, and antihistamines may also inhibit muscarinic receptors inadvertently. It's just a side effect that's sometimes difficult to prevent when you're developing a drug for other neurotransmitter receptors. So there's structural similarity that allows the drug to also hit these receptors, even though we don't want them to. Acetylcholinesterase is another drug target, and this enzyme breaks acetylcholine in half, effectively reducing the time it spends in a synapse. So it will reduce the activity of acetylcholine. So acetylcholinesterase inhibitors have been developed for Alzheimer's disease. Acetylcholinesterase inhibition is also the mode of action for many poisons, including venoms, poisonous mushrooms, and organophosphate insecticides. So you end up with too much acetylcholine, and that activates all the muscarinic receptors and puts them into overdrive, so you get a toxic effect. Drugs for myasthenia gravis, which is an autoimmune disease that reduces the quantity of cholinergic receptors. Drugs for Alzheimer's disease, and huperzine A, interesting compound from Chinese club moss. That is also an acetylcholinesterase inhibitor that's available as a dietary supplement. So the take home here is acetylcholinesterase inhibition can increase the amount of acetylcholine, which is a good thing when it comes to improving memory, but you're going to get side effects if you do that. So it's an inherently problematic drug target and not so attractive for dietary supplements. Adverse effects include nausea, sweating, blurred vision, and restlessness, just to name a few. It's all dose dependent, and some of these compounds are stronger than others in their affinity for the enzyme. Let's switch gears and talk about something that's completely safe, choline. This is a nutrient that is the obvious precursor of acetylcholine. Many US adults don't get enough of the recommended amount, which is 500 to 550 milligrams per day. Risk factors for choline deficiency include low estrogen levels, so menopause, plant-based diets, since animal products are the major source of choline. If you're a vegan or vegetarian, you might not be getting enough. Polymorphisms in specific genes that synthesize choline, like PEMT or MTHFD1, may also be involved in determining somebody's risk. There's a flashcard on integratedpharmacology.com that goes through the influence of estrogen and polymorphisms in the PEMT gene. You might find this information helpful if you deal with postmenopausal women who complain of memory loss. So let's summarize natural products that support cholinergic neurotransmission. So first of all, we have choline. Indications for choline would be memory and cognition, excellent safety. There are 4 options in dietary supplements: choline alpha-cerate, which is alpha-GPC, citicholine, which is CDB-choline. These are both good for memory and cognition. Phosphatidylcholine is another form. Most of the choline that we obtain through food is in the phosphatidylcholine form, and that's used to make cell membranes. And when we're eating animal flesh, we're consuming cell membranes, so that's why that's the major dietary source. Choline bitartrate is very commonly found in dietary supplements, but you always want to look at the dose. You might see choline on the label for a multivitamin, but keep in mind that the daily requirement is about 500 milligrams per day. So if you have a vegan or vegetarian patient and you're looking at a multivitamin that only provides 10 milligrams, that's definitely not enough. Huperzine A, I mentioned this very briefly. I'm not going to elaborate on it. Just be aware that it's out there. It's an acetylcholine esterase inhibitor that may improve memory and cognition, but because it acts on acetylcholine esterase, it may cause side effects that mimic excessive cholinergic discharge in the parasympathetic nervous system. And polyphenols support cognitive performance in part by protecting cholinergic neurons. Polyphenols would include curcumin, resveratrol, flavonoids, compounds that we find in berries and fruits and vegetables. So to summarize very briefly what we've just gone through, drugs that act on cholinergic systems are prone to many side effects, primarily involving the GI tract and cognitive function. Dietary choline is a precursor that can improve memory in patients who are deficient, and deficiency is very common. Keep in mind that adding more choline is not going to improve autonomic function. So, for example, if you have a situation where you need to improve GI motility, adding more choline is not going to help with that because the amount of choline is not the rate-limiting step in that pathophysiological process. Completely different story, but just keep that in mind. And polyphenols support cognitive performance in part by protecting cholinergic neurons. Thanks for your attention, and I hope this has been helpful.